Have you ever noticed how much we trust things that are time-tested? You know, that favorite old jacket of yours that never lets you down. Or that familiar routine. Your head starts pounding, so you grab that one pill you've been taking for 10 years. Or your back acts up, and you reach into the medicine cabinet for the exact same thing that worked a decade ago. We naturally assume that if a method worked 100 times, it's going to work on time number 101. It's just common sense, right? Well, here is a harsh medical reality that doctors talk about behind closed doors at medical boards, but rarely tell patients out loud. Once you cross the age of 60, your body completely rewrites the rule book. And it does it totally behind your back. That exact same familiar pill, that time-tested treatment you've been relying on for years, suddenly turns into a quiet biological threat. Data from major gerontology centers paints a pretty shocking picture. Nearly a third of emergency hospitalizations for older adults have absolutely nothing to do with the illness itself progressing. Instead, it's entirely caused by the side effects of treatments that used to be considered perfect. Think about that for a second. 32% of patients end up in a hospital bed simply because their bodies changed, but their medications stayed the same. And the most insidious part? The body doesn't give you a loud warning signal. Everything happens at the level of micro changes in your receptors and tissues, which we usually dismiss as basic fatigue or just a routine part of getting older. We've broken down 5 of the most dangerous medical traps that almost every single person over 60 falls into when trying to treat their bodies the old way. Trust me, the first 3 on this list are going to surprise you. Because these are medications practically everyone keeps in their home. But one of them, trap number 4, is the ultimate hidden danger. Even the most hardcore health-conscious people have no clue it's happening, and ignoring it can turn fatal in just a matter of months. Before we dive in, a quick but very important disclaimer. Everything we are talking about today is strictly for educational purposes. If you recognize yourself or your current prescriptions in any of these points, please do not panic and throw your pills out the window. Your job is to take this information, go to your primary care doctor, and ask them some tough, necessary questions. Because in medicine, the golden rule is simple. Adjusting a dosage or switching a drug ahead of time saves lives way more effectively than an emergency room team. Time is not on our side here, and every week you stick to an outdated treatment plan increases the risks to your internal organs exponentially. Block 1. The safe painkiller trap. Why ibuprofen and aspirin are no longer your friends. Let's start with something that is sitting in literally everyone's medicine cabinet. Your lower back starts aching after working in the yard. You strain a shoulder, or a joint flares up because the weather is changing. What do? Exactly. You reach for your go-to ibuprofen, Advil, Aleve, or good old aspirin. We've been conditioned to treat these over-the-counter pills like everyday magic. You swallow one, and 20 minutes later, the pain is gone. In your 30s or 40s, it actually worked flawlessly. Your body processed these pills and barely even noticed the strain. But what is actually going on inside your body when you've crossed that 60-year mark? A major player steps onto the stage. Prostaglandins. These are specific lipid compounds that, to put it simply, tell your stomach lining to produce mucus. This mucus acts like a high-tech spacesuit for your stomach, protecting its walls from its own highly corrosive stomach acid. The catch is, as we age, the production of this protective mucus drops all on its own, completely naturally. Now, look at the trap that gets sprung. You take a normal pill for your joint pain. These drugs are designed to block the specific enzymes that cause inflammation. But at the exact same time, they completely shut down those protective prostaglandins. So, while you're successfully taking the edge off your knee pain, that pill is literally stripping away your stomach's protective spacesuit. Your own stomach acid begins eating away at the completely defenseless walls of the organ. Actually, no. And that is the scariest part of this trap. After 60, the sensitivity of the pain receptors in your gastrointestinal tract drops significantly. When a young person gets an ulcer or a severe erosion, it causes intense, sharp pain. But in an older adult, an ulcer can develop with absolutely zero symptoms. No heartburn, no cramps, no discomfort at all. You can take these pills for weeks, thrilled that your back feels great, while a silent bleeding zone is slowly forming inside you. Very often, the absolute first and only symptom of this silent ulcer is sudden paleness, extreme weakness, and dark, tarry stools, which means internal bleeding has started, and you need to call 911 immediately. But it doesn't stop there. These exact same anti-inflammatory drugs take a massive toll on your kidneys. When you're young, your kidneys have an incredible reserve of power and massive blood flow. After 60, your kidney filtration rate drops by an average of about 1% every single year. When you take something like ibuprofen, it constricts the blood vessels inside your kidneys. For an already vulnerable organ, it's like kinking a garden hose. Blood flow plummets, and your kidneys start suffocating from a lack of oxygen, causing them to hold on to excess fluid and sodium. What does that look like in real life? You wake up in the morning and notice your rings are fitting way too tight, or your socks are leaving deep, indented rings around your ankles. That is not just heat swelling or having too much water before bed. That is your kidneys screaming that they are drowning because they've been blocked by a harmless pain pill. Now, connect the dots. That extra fluid gets trapped in your bloodstream. The total volume of your blood goes up, and that pressure has nowhere to go but straight up. Suddenly, you're looking at your blood pressure monitor in disbelief, wondering why your numbers are spiking, even though you're faithfully taking all your regular hypertension meds. Want a quick, simple home test to see how your blood vessels and tissues are handling fluid retention? Take your thumb and press it firmly against the inside of your lower leg, just above the ankle bone, right where the skin sits directly against the bone. Hold it there for about 5 seconds, then let go. If your skin bounces back instantly, perfect. There's no critical fluid backup. But if you're left with a distinct pale dimple that takes 10 to 15 seconds to slowly disappear, you have excess water pooled in your tissues. And if you are regularly taking popular over-the-counter painkillers on top of that, know this. You are actively stressing your kidneys and forcing your heart to run on absolute redline. Alright, so we've covered the basic traps. And if we're being completely honest, the picture looks pretty alarming. But we aren't here to panic or collectively down a bottle of valerian root. By the way, you need to be careful with that one after 62, but we'll save that for another day. Our goal is to figure out exactly what to do so that your medicine cabinet actually protects you instead of running a covert sabotage operation against your body. Since we've established that the old routines just don't cut it anymore, let's build a fresh, foolproof safety manual. We are going to break down concrete steps, the exact lab tests you need to get right now to see how your organs are handling your pills. What to use instead of those risky painkillers, and how to script your next doctor's appointment so they don't just brush you off with a generic, well, what do you expect at your age? Block 2. Vitamin Madness. How innocent supplements trigger a calcium storm in your arteries. Let's take off the rose-colored glasses when it comes to natural vitamins. There is a massive trend right now targeted heavily at older adults, promising rock-solid bones and an easy fix for osteoporosis. I'm talking about mega doses of calcium paired with vitamin D. Everyone's logic seems flawless. I'm over 60, my bones are getting brittle, so I need to swallow calcium by the handful to keep them from breaking. Sounds perfectly reasonable, right? Absolutely, but only on paper. In reality, your body's calcium-phosphorus metabolism undergoes a massive shift after age 60. Back when you were young, your skeleton acted like a giant sponge. It instantly soaked up any incoming calcium and sent it straight into your bone tissue. But as we get older, changing hormone levels cause bone cells to lose their ability to lock that mineral in. So picture this. You buy a highly advertised calcium complex with a massive dosage and start taking it every single day. Where is all that building material supposed to go if your bones are turning it away? Your body can't just magically evaporate excess minerals. That calcium keeps circulating in your bloodstream, looking for a place to park. And it finds the perfect spot. The microscopic damage lining the inner walls of your blood vessels. In medicine, this process is called calcification, or, in plain English, turning your blood vessels into stone. Instead of strengthening your skeleton, that excess calcium mixes with cholesterol and literally cements your arteries shut. Soft, elastic vessels that are supposed to expand and contract with every single heartbeat turn into rigid, brittle glass tubes. The danger? A sharp, uncontrollable spike in your bottom, diastolic, blood pressure, and a massive workload for your heart, which now has to force blood through completely stiff, unyielding stone pipes. But it gets even worse if this calcium storm hits your kidneys. The excess mineral starts to crystallize in the renal pelvis, turning first into sand and then into sharp, jagged kidney stones. Instead of getting protection from fractures, a person ends up with severe kidney stones and excruciating renal colic. Block 3. Trap number 4. Sleeping pills that erase your personality and kill your balance. Now let's move on to that fourth trap, the ultimate hidden danger I warned you about at the very beginning. As we age, our sleep cycles naturally get disrupted. Falling asleep on time becomes a nightmare. You wake up at 4 a.m. tossing and turning, and you feel completely exhausted. What's the first thought that pops into your head? Go to the doctor, or worse, take a neighbor's advice and grab some reliable sedatives or sleeping pills. Most of the time, people end up using drugs from the benzodiazepine family, or what doctors call Z drugs. In your 40s, these pills were straightforward. You took one, slept for 8 hours, woke up with a clear head, and went to work. Your liver and kidneys flushed out the leftovers in a couple of hours. But after 60, your liver's metabolic speed slows down 2 to 3-fold, and your body's fat-to-muscle ratio naturally increases, even if you stay relatively lean. And these medications happen to be fat-soluble. What does that mean in practice? The pill you took last night isn't gone by morning. It literally gets trapped in your tissues and keeps slowly leaking back into your bloodstream all through the next day. You think you're fully awake and in control, but your brain is actually running on a continuous drip of a powerful tranquilizer. This triggers 2 scary effects that relatives almost always mistake for senile dementia. First, your cognitive function takes a massive hit. You experience brain fog, minor memory lapses, and a sudden struggle to find the right words or remember where you put your glasses 2 minutes ago. Second, and this is the truly dangerous part, it completely throws off your micro-coordination and muscle tone. You might not notice it while sitting in a chair, but the moment you get up in the middle of the night to use the bathroom in a dark room, your groggy, chemically relaxed brain loses control of your balance for a split second. You trip over nothing, lose your footing, and suffer the one thing we all dread: a broken hip. The medical statistics are brutal. The risk of severe falls and traumatic injuries for people over 60 doubles during the very first weeks of taking any sleeping medication. This isn't age-related clumsiness. It is the direct, toxic hangover of a drug accumulating in your system. Block 4. Crashing your blood pressure. The danger of legacy hypertension routine. Let's look at a classic scenario. A person is diagnosed with high blood pressure at age 50 and gets prescribed an excellent combination pill. The medication works beautifully. Blood pressure stabilizes at that golden 120/80 mark, and life is good. They keep taking that exact same dosage for 10 years, 15 years. They are completely convinced that since the routine works, changing it would only mess things up. But by the time you hit 65, the large arteries in your body, including the ones supplying your brain, naturally stiffen up. They become way less sensitive to pressure changes. Because of that, the blood pressure that was considered perfect in your 40s, 120/80, can actually turn out to be dangerously low for a 65-year-old brain. Yes, you heard that right. Modern gerontology guidelines explicitly state that the boundaries of normal shift as we age. Trying to aggressively force blood pressure down to youthful metrics using old medication doses is a massive mistake. When you take a legacy dosage that is now way too aggressive for your changing body, your blood pressure can drop below the critical threshold your brain needs to function. Doctors call this orthostatic hypotension. What does this look like in everyday life? You're sitting on the couch watching TV. You stand up quickly to answer the door or turn off the kettle. And right in that moment, your vision goes dark, your head spins, and your legs feel like jelly for a second. In that brief window, your brain just experienced actual ischemic starvation. Your blood vessels simply couldn't pump blood upward against gravity fast enough, because your morning blood pressure pill relaxed them way too much. Letting these episodes happen repeatedly is a direct fast track to chronic vascular dementia and microstrokes. Your blood pressure routine needs to be reevaluated with a cardiologist every few years to match the actual state of your blood vessels, rather than blindly following a prescription from 15 years ago. Want to run a quick test right now to check your autonomic nervous system and see if you're at risk for one of these dangerous blood pressure drops? You'll just need a standard home blood pressure monitor. Sit down, relax completely for 5 minutes, and take your reading. Write those numbers down. Next, stand up calmly. Wait exactly 1 minute while standing, and take your reading again without sitting back down. Now compare the results. Normally, your top, systolic, number shouldn't change by more than 5 to 10 points when you stand up. But if your top number drops by 20 points or more while standing, say it goes from 135 sitting down to 110 standing up, congratulations! You have a positive orthostatic test. This is a direct red flag that your current blood pressure routine is working way too aggressively. Your vessels aren't adapting, and you are risking a random fainting spell every time you move too fast. Part 3. The final safety protocol. How to avoid getting caught in the medication avalanche. There is one more phenomenon that we absolutely have to discuss honestly. In the medical world, it goes by an official name, polypharmacy. But if we translate that into plain English, it's a medication avalanche, or the over-treatment syndrome. Here is how it happens. First, you take a single pill for high blood pressure. It gives you a mild side effect, say a persistent dry cough or slightly swollen ankles. You go to a different doctor, complain about the cough, and they write you a second prescription, this time for the cough. That cough medicine starts irritating your stomach lining, so they add a third pill to protect your stomach. Fast forward a couple of years, and you find yourself sitting in front of a mountain of 8 to 10 different capsules that you swallow every single day, without having any clue which one is actually treating you and which one is just masking the side effects of the previous drug. Once you pass 60, this exact avalanche can completely wreck your internal balance and immune system. When 5 or more different chemical compounds are mixing together in your body at the same time, their interactions become completely unpredictable. They either start canceling each other out, or they multiply each other's toxicity exponentially. Block 5. The brain fog. How trusted diabetes meds quietly drain your mind. Before we clean out that medicine cabinet, let's look at one more classic medical story that impacts millions. When a person is diagnosed with type 2 diabetes around age 50, they are typically put on standard blood sugar lowering therapies. And that is exactly what should happen. High blood sugar destroys blood vessels. The patient gets used to taking their pills for years, keeps an eye on their numbers, and everything seems stable. But let's look inside a body that has reached 65 or 70. Over the years, a person's natural glycogen reserve in the liver, which is our internal backup fuel tank for sugar during times of fasting or stress, naturally declines. At the exact same time, your kidneys and liver slow down when it comes to clearing medications out of your system. This is exactly where that old, once perfectly tailored diabetes dosage sets a trap. The medication keeps pushing your blood sugar down with the exact same strength as before, but a vulnerable, aging body can no longer balance the process in time. As a result, your blood sugar starts quietly dropping below normal. Doctors call this hidden or asymptomatic hypoglycemia. In younger people, a drop in blood sugar triggers an intense adrenaline rush, extreme hunger, cold sweats, shaking hands, and panic. The organs scream for help. But after 60, these bright warning signs very often just turn off. You don't feel the shakes, and you don't break out in a sweat. Instead, your brain, which relies entirely on glucose as its only fuel source, begins to quietly suffocate. In everyday life, this shows up as strange episodes that get brushed off as basic fatigue. An older adult suddenly becomes lethargic in the middle of the day, gets confused, struggles to focus, or displays uncharacteristic anger or total apathy. Half an hour later, things seem to pass on their own when the liver dumps its last remaining carbohydrate scraps. But every single one of these silent hypoglycemic spikes literally burns out thousands of neurons in the brain. Constant, unnoticed drops in blood sugar caused by an outdated treatment routine hit your memory and cognitive sharpness harder than years of vascular disease, accelerating dementia by several fold. The exact dosage that saved you at 50 could be slowly turning off your brain at 60. Block 6. Home Audit, the clean box method. To stop this chemical chaos, I want you to run a highly effective practical experiment right at home. Let's call it the clean box method. Step 1. Gather the evidence. Take a large box and collect absolutely every single medication, ointment, drop, vitamin, and dietary supplement sitting in your cupboards, on your nightstand, or on the kitchen counter. Step 2. Sort by category. Divide that mountain into 3 piles. Pile number 1 is your lifeline medications, the ones strictly prescribed by your cardiologist, endocrinologist, or neurologist that you cannot skip, like blood pressure, blood thinners, or insulin. Pile number 2 is symptomatic fixes. Things you only grab when something actively hurts. Painkillers, fever reducers, nasal sprays. Pile number 3 is preventative maintenance. Vitamins, herbal blends, and supplements you bought because of a commercial or a friend's recommendation. Step 3. Ruthless expiration check. You'd be shocked at how many medications in our homes expired a year or two ago. Taking expired meds after 60 is a massive risk. The chemical composition of a pill changes over time, and instead of a therapeutic effect, you can end up with severe toxicity or an allergic reaction. Anything past its expiration date goes straight into the trash. Step 4. Evaluate necessity. Look closely at pile number 3, the preventative stuff. Remember, after 60, the phrase, "it can't hurt," does not exist in medicine. It can. Every extra capsule is a heavy tax on your kidney filtration and liver metabolism. If you are swallowing a vitamin complex just because you feel like you need more energy, but you haven't actually run blood work to prove a specific deficiency, take it out of your daily routine. Keep only what your body genuinely needs based on explicit medical guidance. Block 7. The Golden Rules of Smart Longevity. Let's lock in 3 simple, ironclad rules that will serve as your personal shield against any future medical traps. 1. Never self-prescribe based on the internet or a friend's advice. If your neighbor Mary swears this incredible European supplement cured her high blood pressure in 5 minutes, all that means is it worked for Mary. She has her own kidney filtration rate, her own vascular elasticity, and her own unique blend of diagnoses. Trying to copy her routine can throw your body into a massive crisis. 2. Always read the drug interactions section. Whenever you get prescribed a new drug, don't ignore that massive folded paper insert inside the box. Find the compatibility section. If you see that your new medication conflicts with something you've been taking for years, that is your cue to immediately call your doctor and ask for an alternative. 3. Listen to your symptoms, not your birth certificate. Your body is a highly fine-tuned biochemical machine. If you start noticing persistent mild nausea, a strange weakness when you wake up, dizziness when standing up from bed, or new swelling in your legs while taking a trusted drug, don't blame the weather, your age, or a bad night's sleep. Those are signs that your treatment routine has started to fail. Your body is trying to talk to you. Listen to it. Your next step to an active life. Well, my friend, we have covered a massive amount of ground. We've unmasked the hidden traps, checked in on your kidneys and stomach, figured out the exact blood work you need, and learned how to talk to doctors on their own terms. Now, the ball is entirely in your court. Your health after 60 isn't about winding down. It's just about playing by a smarter, more conscious set of rules. And if you play by them honestly, you have decades of active, vibrant, and joyful living ahead of you, completely free of endless doctor visits and emergency room scares. Go ahead and subscribe to the channel right now if you haven't already, so you don't miss our upcoming medical mythbusters. And make sure to click on the video that just popped up on your screen. In it, we break down step by step how to gently and safely restore your joint mobility without a single chemical pill, relying entirely on smart biomechanics and simple home movements. Click that link, turn it on, and stay healthy.